Hey Jesse,
Hey, Michael.
I've got a question for you. So, would you send a client with back pain to go and get an MRI? Yes or no?
Most probably not. So no, I wouldn't send a client with back pain for MRI straight away.
Why not?
For most parts, I was going to say that for most parts, it doesn't change treatment outcomes. It doesn't matter if you have MRI or not, but that's not true on second thoughts. You actually have poorer treatment outcomes when you go for MRI. So people who go for MRI at the early onset of their back pain tend to spend more money on their back pain treatment. They take longer to get better, so delayed recovery, and also they have poorer quality of life. So not intuitive, but we have research to show that MRI actually worsens back pain patients' outcomes. So it doesn't really
Right.
make sense it doesn't really make sense to MRI patients with back pain right at the onset. Does that kind of answer your question?
Yeah, yeah. Would there be any instances in that you do go and send patients for MRIs?
Yeah, probably. So I wouldn't say that MRI is totally useless. So if you know what you're looking for, MRI is a good imaging strategy to help you diagnose cases or certain symptoms. So for example, let's say if you have changes in like when how you go your toilet pattern, so changes in bowel movements, changes in urinary function, maybe loss of sensation around your groin, or even sudden worsening of neurological function. So let's say you suddenly can't use your legs anymore. Those are pretty good indicators for MRI. We consider them red flags. So these are the things that you kind of want to, or these are the symptoms that you want to look into. And when a patient experiences them in conjunction with back pain, we would probably want to refer them. No, we would definitely want to refer them for a back lumbar spine MRI. There are also other instances where we're looking for maybe specific stuff, so not so much to investigate per se. So when we start to suspect that the person might have a tumor or maybe a fracture. But when it comes to fracture, it's maybe more straightforward. It's usually like car accident, and part of the diagnostic process would include imaging of sorts. Yeah.
Yeah, yeah. So I mean, those red flags are pretty serious type symptoms that you'd be looking out for, and fairly obvious
Yeah.
symptoms. You could
Yeah, I think
pretty easily say to someone, maybe you should go and get this checked out.
Yeah, yeah, I would say
Yeah,
that by the time you start to show red flags, the symptoms, the red flag symptoms, like changes in bowel function or progressive neurological loss, function loss, or like can't use your legs and stuff like that. You would probably you would probably not focus so much on the pain anymore. Your back pain probably would take a secondary priority, and you would probably investigate more of the red flags first,
yeah,
even
yeah.
as a patient. Yeah.
Yeah. All right. So let's take it back to the back pain a little bit.
Yeah, sure.
So if without an MRI, how do we know what's going on? So if you're wanting to treat a patient, but you can't actually see what's going on underneath, how do you treat them?
Yeah, that's a fair question. I think that's a common understanding around people, or maybe misunderstanding around people, that you need to see what's going on, or you need to find out what's going on in order to treat the person. Assuming that was true, then people with back pain who underwent MRI should have better outcomes than those who didn't go for MRI. But we don't see that's true. We see that their quality of life is poorer. We see that they take longer to get better. So it's really not necessary to see what's going on in your low back or in your lumbar spine to treat back pain. I think, not, yeah, one of the strongest reasons for that is because a lot of people without back pain, or any symptoms, so asymptomatic population, a lot of these people would also have what we consider abnormal MRI findings. So like degeneration, which is like a big thing these days, or slip disc, a huge percent of population without back pain actually have them as well. So that kind of challenges the idea that if you have a slip disc, you have pain. But that correlation is quite poor. So following the same train of thought, it doesn't make sense for you to assume pain comes from abnormal MRI finding, because a lot of people without pain actually has them. Does it kind of make
Right.
sense to?
Yeah, yeah. I mean, so like for example, I don't have back pain at the moment,
Yeah.
but if I was to go and have an MRI done on my back, would I is it likely that I would find some sort of abnormal finding or have something that doesn't look quite normal, I guess, in that image?
I see where you're coming from. So that kind of depends on how old you are, right? So it's age specific. So maybe, do you want to share a bit more about how old you are, or like, just the first
Sure,
number?
let's go mid 20s to 30s.
Mid 20s to 30s. Let's go with 30s because like
let's
the
go 30s. All right. Let's go 30.
Yeah, you collect this like every 10th year. So if you're in your 30s, there is a 50% chance that you would have shown signs of degeneration, even if you have no pain. Right. Okay, so that's a lot, like 1 in 2, right? Yeah, so when it comes to other stuff, let's say a disc bulge, you're looking closer at 40%. So 40% of the people in their 30s would have disc bulge, and they have absolutely no symptoms.
Yeah, right. So that's a pretty big percentage of the population who have some sort of, I guess, abnormal finding or degenerative, or like you say, the disc bulge finding. So, say for example, someone does go and have an MRI because they've got a bit of back pain and they have this, they find this. How likely are we able to actually connect that finding to the pain itself? Is that can we do that?
I would say it's impossible. So you're asking if we can tell whether an MRI finding, so like a slip disc, causes back pain, right? How do we establish the relationship, right? Yeah, I think like maybe for slip disc it's possible, so we can correlate to other symptoms. Let's say like if you have radiculopathy, so leg pain, there is very consistently recreatable in the orthopedic testing. So putting in certain positions always recreate the pain. Then maybe that can be linked to that your back pain is actually due to a disc issue. But for most parts, we deal with them separately. So if you have radiculopathy from slip disc, or this herniation, you would deal with the radiculopathy separate from the back pain, I would say. Separate from the slip disc, I would say. So no, I don't really think we look at it that way anymore, where we kind of try to find things wrong with your spine and match it to symptoms. And we're not sure if it's possible, to be honest, because too many people without pain have the same MRI finding. So it doesn't make sense to just assume that if you have the finding, that is why you have the pain.
Yeah, I guess so. And like if that, say for example, patient again goes and has a scan, they find something, unless they've got previous scans before they had pain, there's nothing to compare to either. They don't really have that baseline comparison to say, look, there was nothing here before and now you've got pain and there's something here. So
so when someone MRIs themselves when they're in their 30s and they find let's say a degenerated disc, it's not to say that that started at a point in time when they have pain. They could have had that since they were in their teens, and it's impossible to make that sort of assumption or any sort of guesses on when that started, because we don't have a baseline scan. How did this person's spine look before they had pain? I guess nothing to compare to, I guess.
So bit of a summary. You're unlikely to send someone off for an MRI if they come in for back pain.
Very unlikely,
unless they do sort of indicate some of those red flags, like changes of like neurological symptoms getting worse, changes in bladder and bowel control, loss of sensation, things like that. But again, you're not going to send them off because it's very difficult, if near impossible, to actually determine a cause and effect relationship between those findings on the MRI and the pain that those people are experiencing. Would you have any suggestions for people out there as to, I don't know, how best to approach it if they've got sort of long or even short-term back pain? A first step to take, maybe?
The first step to take is probably to keep an open mind. Try not to tunnel vision yourself to like a cause. It's quite common to hear people say like, they have back pain because they don't stretch enough, or, they have slip disc and things like that. It's really hard to determine those relationship. So the best thing is to keep an open mind. Don't try to think of your pain as having just one specific cause. Just research-wise, we know that it's multifactorial. There are many factors that go into why someone has back pain. So the first thing to do is to not tunnel vision. And I think coming along with that, it's way better if you want to focus on something to think about, to focus on solutions. So what can you do to make your pain go away? For most people, they would not have pain for their entire lives. So if they can focus on how things were like before they started having pain, and how they can change their lifestyle or change how they are, so fitness levels, things like that, to their pre-pain state, that would be a good sort of direction to focus going into.
Yeah, great. I think that's pretty good advice, I think, for someone who's not quite sure what to do. Yeah, thank you.
No worries, thank you. Good luck with your back pain patient.
Yeah, thanks. See you next time.